Welcome, everyone. My name is Dr. Ritch Hall. I am a licensed psychologist in the city of Cincinnati, who currently works for Miami University in their student counseling service, as well as in a private practice called PsychWorks Clinic, LLC. And I am the president of the Cincinnati chapter of the Association of Black Psychologists. And today we are partnering with the Center for the Closing the Health Gap to bring to you a presentation, a conversation amongst psychologists, a virtual panel of sorts, where we will be talking about racism, discrimination, and microaggressions. So I have several colleagues here. But first, I just want to tell you that the Association of Black Psychologists Cincinnati chapter is a professional group of psychologists, students, and affiliates who operate under the mission of promoting, advancing the profession of African psychology to influence social change, develop programs to assist solving problems in Black communities and other groups, which is why we have this partnership today. So I'm glad you could join us so that we could, dispense some good information and hopefully have a good conversation. At the beginning, there will be the virtual panel. So there'll be a number of questions I'll be asking my colleagues, and we'll be talking amongst ourselves. And then at the end, there will be a 20-minute question and answer session where you will be allowed to unmute yourselves to be able to speak and ask us questions. Beyond that, I will introduce our guests and they will introduce themselves. So first up, I'm going purely by alphabetical order and not by order of importance in my life. But if I were, this person would still be next, and that's Dr. Kathy Burlew.
Hello, everybody. I'm Kathy Burlew. As Rich said, a member of the Association of Black Psychologists. And I'm looking forward just to a discussion of microaggressions. And I believe, Rich, if people can add questions in the chat along the way, is that
yes,
true?
If at any time you do have a question for us, you may add it to the chat and we will do our best to address it as we go along.
And just finally, I'm a professor emeritus at the University of Cincinnati of psychology. And then I currently head psychological services at the Crossroads Center, a substance abuse clinic.
All right, and then next up is Dr. Adam Evans.
Hello, everyone. Good evening. I am a licensed psychologist here in the city. I am the sole proprietor of my own private practice, and it's good to be here, and I look forward to a great discussion, and I am a member of Psy as well.
All right, thanks, Dr. Evans. And next up is Dr. Jeff Menzise.
Rich, are you still going in order of importance or what, man?
We're getting close to the bottom.
Right.
I'm like, hold on, man.
Well, you're not last, Jeff. So.
Right, that's why I'm feeling that. So, okay. All right, I'm Jeff Menzise. I'm a professor at Morgan State University in Baltimore, a member of Psy, former president of the DC chapter of the Association of Black Psychologists, community educator, and all of that other stuff. It's good to see you all.
Nice. And definitely not the least important person on the panel. This has nothing to do with her level of importance, but because her last name starts with a P, Dr. Miska Prater.
Hi, everyone. I'm Dr. Miska Prater. I am the vice president of the Cincinnati chapter of Psy. I am also a therapist at a Sound Mind Counseling, and I'm super excited to be here.
Great. We're all excited to have everybody here today. And so we're just going to get into a conversation about our topics today. And first up, I'm going to share my screen just briefly because these terms, as I was trying to figure out how to share them, I couldn't figure out how to do it without putting words on the screen. So I'm going to share my screen so you could see these words, and then we'll talk a little bit about, we'll get into some conversational discussion about how these terms affect people. The first term that I'm going to share is racism and what we understand as racism. And this is pulled from the Association of Professional Psychology, APA, and their definitions of racism, which is a form of prejudice that assumes that the members of racial categories have distinctive characteristics, that these differences result in some racial groups being inferior to others, and that it usually includes negative emotional reactions to members of a group, acceptance of negative stereotypes, racial discrimination against individuals, and in some cases, it can lead to violence. There is also aversive racism, everyday racism, institutionalized racism, and modern racism, as well as ethnocentrism. So that's one of the sort of baseline terms we'll be using today as we discuss this topic. The next is microaggressions. These are brief and commonplace verbal, behavioral, and situational indignities that communicate hostile, derogatory, or negative slights or insults, especially towards members of a minority or oppressed group. They may be intentional, such as calling a transgender person a she-male, or implicit, such as a white employee asking a Black colleague how he or she got a certain job, implying that they might not have obtained it by virtue of their skill or ability, but through affirmative action or a quota system. And there are 3 subtypes to microaggressions. Those are microassaults, which are purposely discriminatory actions, like a racial slur or displaying a swastika. Micro insults, which might be subtle snubs that devalue a person's identity. And lastly, micro invalidations, which are unintentional exclusions or negations of an individual's thoughts or identity. And so those are microaggressions, this type of behavior that can be engaged in towards a person from a minority or person of color that might not be intentional, but might be implicit and can affect how that person interacts with others or what they believe about themselves. Like I said, we'll get more into these topics as we go on, but I just want to have some baseline definitions to help us with this discussion. And then lastly is code switching. And that is a strategy that involves the adjustment of a style of speech, appearance, behavior, and expression in ways that will optimize the comfort of others in exchange for fair treatment, quality service, and employment opportunities. And so that's the idea that in order to navigate the world, particularly a white assimilated white world that often encourages assimilation as a primary way of interaction, we must learn how to code switch. So most Black people, most minorities know there's a way you can talk at home that you don't bring to the office. Right. And one of the ways in which I think this is important, particularly right now, is because for many of us, we were working from home during the pandemic and had to go into the office. And that transition brought with it some level of discomfort because I will say from my personal point of view, I was talking to my kids and my wife most of the time. And going back into the work bit, I had to remember how to talk to white people. And so I couldn't just say things off the top of my head. A good example of that was somebody asked me a question, and rather than saying, yes, I'll do that, I just kind of said, yeah, bet. And it's like, wait, they don't have a context for how this is me agreeing to this thing they've asked of me. And so there were many times where I had to like slow myself down and remember what's the code switch way of speaking to this person that will get them to understand what I mean and not necessarily be me speaking from what we call a cultural vernacular, like speaking as if I were at home. And so I thought that it brought with it, as people were transitioning back to the office and back to these sort of more mixed environments, some level of distress and discomfort. And we'll talk a little bit about that today as we discuss some of these topics. And so first up, we're going to talk about how do you manage microaggressions, particularly in a work environment without jeopardizing your employment. And we'll talk a little bit about what some of those microaggressions might be. And I believe Kathy was ready to field this question first.
Okay, so let me just give an example. Suppose a boss tells a joke or makes a comment that you view as a microaggression. What are your options? Maybe they say something like, well, most of the players in the NFL and NBA have babies all over the country, or I don't trust that leader's credibility because of the way she or he talks, or I find Black women super sexy. One option, of course, and you may decide that it is the best option, is to let the person know at that moment that the comment is offensive. However, you may be thinking, well, you know, I got a kid in college, mortgage to pay. So I want to consider some other options. And I'm not saying that any one option is better than the other. But we were looking to see, there's a person whose name is Daryl Sue, who writes about microaggressions. And he suggested that if you decide that this isn't the time, it's up to you. This isn't the time that you want to tell the person off. What'd you say? Oh, someone else. that this isn't the time that you want to tell someone off, that there's some things to consider. First, you have to decide whether you want to respond immediately or seek counseling and advice from others before you respond. For me, it's helpful to go to somebody else and say, you know, so what so-and-so said, you know, what do you think? What do you think I should do, rather than responding immediately? And then you have to decide whether and how you're going to respond. Even if you decide not to respond, if this happens at work, you may want to document the situation in case you want to show later that it's a pattern. It's not just happening one time. And if you deem the microaggression is significant enough to report, determine who and what office is the best place to report that microaggression, if that's the route that you've taken. So those are just some initial thoughts. And I hope the way we're going to do this, Richie, is that one of the other panelists might have some other thoughts about workplace microaggressions.
Yeah,
Absolutely.
Chime in if I can. I'm sorry.
Sure, Jeff.
Yeah, Doc, I agree with you as far as, you know, the proper steps. One thing I like to focus on when working with people who experience microaggressions is to decrease their sensitivity to the experiencing of microaggressions. One thing that I found is sometimes that people are consciously launching microaggressions at other people. You know, sometimes it's unconscious, other times it's conscious. And in the cases where it's conscious and intentionally being done, it's usually being done to get some type of reaction out of the person, you know, who's the recipient or the victim of the aggression. And if we can systematically somehow work to decrease our sensitivity to these microaggressions, we're less likely to react to them, right? We're less likely to not only overtly and in a behavioral manner or verbal manner react to them, but we're also less likely to have the deep emotional trauma that oftentimes come with it, right? And I think that those are the detrimental effects of microaggression. You know, it stresses you. You know, it increases stress. It can even create anxiety and depression. You know, it can impact work performance, school performance. And if you can somehow inoculate yourself, you know, buffer yourself and be less sensitive, less responsive to those things, then what we do is, in effect, we render them ineffective. And I think that to me, you know, as you know, many of us working as clinicians or trained as clinicians, I think that would be one of our primary goals in addressing microaggressions, and especially looking at it from the victim side of it.
Good point.
I think you definitely bring up a good point there, Jeff. And one of the things that comes to mind is this idea of racial gaslighting. The idea that some of these people are doing this, and very often we're struggling with people who are acting as if some of these racial things aren't happening, even though they might be overtly behaving towards us in a certain way. And it often can kind of lead to a kind of, you know, having to question yourself, is this really happening that way? That's why I appreciated what Kathy was saying a moment ago, this idea that going to someone to talk about it means I get to sort of reality test, is my experience of this what's actually happening? And I know that Miska, you had some points on racial gaslighting, and if you could share those with us at this time.
Sure. Like Ritch said, that's kind of like when people are trying to make you feel like you are overreacting about a certain comment or behavior that is kind of geared toward you. For instance, when people try to disarm you by saying that they don't see color, which completely erases who you are as a person, or denying that something that they said or did was racially aggressive, saying things like you can't take a joke, like you're too sensitive, like you're just doing too much all the time. These are all examples of racial gaslighting, and that's why it's important to check in with yourself and kind of be aware that these are things that happen and that people will repeatedly try to make you think that these aren't happening or that you're overreacting or doing too much. So it's good to keep in mind, particularly in professional environments.
I always think of the idea that, you know, in some professional environments, we don't always have the leverage to react immediately to some of these threats. And so you have to be very attuned to the idea of what level of power do I have in this situation? And by virtue of that, what can I do? Because if I don't have a lot of power, then overreacting, or a reaction might look like an overreaction because I might not have the authority to get this person to react or to change their behavior in a way I'd like. And so unfortunately that undue burden is often placed on the person in the minority status, and more often than not, in some environments, the person with the least amount of power to do anything in that moment. But the idea that you do need to be a very self-reflective, I think, is important to step back and assess the situation as it's happening, to see where you have some level of control. And I also want to echo Jeff's points earlier that sometimes these things are just going to happen, and you have to learn how to inoculate yourself to them so that you're not finding yourself constantly being triggered. That isn't to say that the unfair situation should be allowed to stand in every circumstance, but that often that feeling of helplessness that might happen when we experience some of these things like racial gaslighting or microaggressions, we don't have to always feel that. There are things that can be done.
Responding from a level disposition, non-emotional, non-triggered, you actually become more efficient and more effective in your reporting of it. Because we've all seen situations of, especially when I was doing couples work, you'll see a situation where somebody knows exactly where their button is, man, and they'll push that button, set the other person emotionally off, and they become, exponentially more ineffective in communicating their point. And the person is really trying to make them look crazy, as you were saying. And so, from that level of disposition, is actually you're arming yourself to go ahead and take the proper steps next, without being triggered, without being emotional. There's nothing they can do to you at that point. They have to just deal with the record, and the logic and the facts of the situation.
Right. And not always easy, right?
Not at all.
Sometimes there's a lot of work you got to do to learn how do I check myself in these situations. And if you're doing that work across the board, it often makes it easier to do that work. That's why, if you're a person with a short temper, find ways to work on it, find people who you can sort of depend on and support you, because it sometimes it takes a lot. Sometimes folks really try to push your buttons and try and push you. I want to loop back into something we were talking about a little bit earlier, and that is code switching, this idea that we have to learn in some of these office environments to how do we code switch. Let's talk a little bit about why people might code switch in the workplace and whether or not there are repercussions for that behavior. And I think Adam was prepared for that question.
Yeah, I wanted to say just a little bit of something about the previous discussion, and I don't want to bring politics into this, but it is kind of hard to leave it here floating on the outside. But I think more of these egregious behaviors occur in organizations where there's less than 3% of minorities or people of color working there. And so you can imagine when you are surrounded in an organization with people of power who look different than you and who are the dominant power, it makes it really hard in terms of how do I react when I do experience a microaggression. And I think the other part of that is, you had the last administration of a president that just kind of trounced these kind of egregious remarks and et cetera. And, people went along with that. So I think that just kind of really permeates the air, and it makes it really hard for people of color to figure out what to do and how to do it with fear of losing their job or et cetera. So one of the questions was, why do people code switch in the workplace? And I found some interesting reasons for that. And one is increased perceptions of professionals and the percentage and odds of being hired. A second one is to avoid negative identity. For example, the notion of being incompetent, being lazy, increasing the perception of being seen as leaders. Because when you're seen as a leader, then you can move up in the organization that you're in. And then the third one is expressing shared interests in dominant group promotes similarity with the powerful organizational members, and that this increases the percentage of promotions. So in other words, if I can be more like them, or if I'm perceived as similar to them, then I have a higher opportunity of being promoted at the agency. So we might code switch. Are there repercussions with code switching? Yes. Code switching comes with social and psychological repercussions. For example, in-group members can view the behaviors as, quote, acting white. Depletion of your cognitive resources. It takes a lot of energy avoiding stereotypes. You're always anxious. You're always thinking about it, how you are being perceived, how you're behaving, how you're talking, in many instances, how you're moving, your style of clothing, etc. And then the last one is it reduces your authentic self. And this, of course, results in burnout at work.
Do others have thoughts they'd like to add to Adam's statements? I do think it was very, very comprehensive, and thank you.
Yeah, I was going to jump in and grab that dead air, man, but I don't want to, keep talking. But
You're good,
it's
Jeff.
really interesting, and thanks for that, Adam. When you talk about the negative impact of it, one of the number one things I see, and I tend to, is the whole aspect of devaluing your own culture. Because to code switch, especially in a quote unquote professional setting, what you're doing is you're saying that my natural cultural disposition is not good enough for this environment. It's not, and I know this is not necessarily the conscious thing, but these are some of the implications, right? And not only is mine not good enough, but theirs is. Theirs is better. Theirs is the quote unquote superior one. But at the same time, it's strategic. And I think that's what it's born out of, is strategy for survival. So like, for example, your example earlier, Rich, and I thought about this, you said, all right, bet, you said, yeah, bet. And, immediately I thought, oh my God, he's advocating gambling on the job. You know what I mean? Because you said bet. And so it can be a strategic thing and not necessarily a self-demeaning thing. But at the same time, I live for the day that we are able to be who we are. Like I try to consistently be who I am everywhere I go. If I'm over in, overseas, I'm gonna be who you see right now. And I do that. I set that up for myself intentionally so that I'm not devaluing who I am. When we were on with the folks from Bahamas the other day, and I talked about Nevis. That was one thing. You want to instill pride in your existing culture before you go and face this so-called dominant culture, because that power equation is very real. And we oftentimes end up on the lesser than side of the equation.
Yeah, and I wanted to totally back you up there, because I know a lot of the research shows that, racism takes its toll on the minority to a greater extent. I mean, it takes its toll on the greater society for sure, but they're not trying to look at those numbers. But one of the ways that we can make ourselves resilient is by recognizing the value of our cultural identity for what it is, that there are resiliencies within us. And even though, many of us for, decades have been taught to shave down these aspects of our cultural identity, to not be as Black or as bold in these environments, learning to have some cultural pride in who you are is how you can weather some of these storms.
And we have to remember that a lot of this is born by internalized racism as well. And we see ourselves as less competent and or as less compared to the dominant culture or other cultures that are different from ours. So a good way of being comfortable in your own skin is just by experiencing yourself in your own skin in a variety of different situations. That's how you develop the comfort.
Absolutely, absolutely. And one thing that I can't get through this conversation without taking a moment to address is very often we talk about, and we talked about it even earlier, how you can sort of develop some of this cultural identity is through therapy, through cultural experiences, through having a therapist who is culturally sensitive. But we do know that many people, even in this audience, might have a mistrust of therapists and of psychology. And one of the things that we should really be considerate of, and I know Jeff has some information here, is the role that racism and discrimination has played in African Americans in being able to trust the mental health institutions as far as service providers. So Jeff, could you help us understand why people might have some of those attitudes?
Yeah, I appreciate that, Rich. So, with that definition of racism, that we led with, I really love to add a portion of Dr. Francis Cress Wells's definition of racism. They say that racism is a power equation, right? Of domination of one race over another race just by virtue of the races being different. One thing in our opening definition talked about racial distinctions and characteristics. And to me, I want us to make sure that we understand that the distinctions do exist. You know what I mean? There are differences between races. And I think what happens is that they have systematically packaged our characteristics and traits as people of African descent and made all of those things the negative characteristics and traits. Those are inferior, and they take all of their characteristics and traits and make those the superior attributes of human beingness. And if you just do a simple study or review of history, you see, if we're talking about mental health being about social interaction and pro-social behaviors and being able to get along with each other in your environment, we would see that it's actually the exact opposite. Much of European history is in conflict with itself and its environment. Much of non-white history on the entire planet is more an experience of harmony with each other in the environment. Like rainforests weren't getting decimated when indigenous people were living there. It wasn't until Christopher Columbus and them showed up, right? And so, that power equation, I think, is very, very important for us to keep in mind when it comes to that definition of racism, because then what that does is it does what Mr. Fuller and Wells say. Racism is the only functional form of racism is white supremacy, right? And so that disarms them, saying, well, you're being racist too as a Black person. I can't be racist as a Black person, not under the existing system, not here nor there. So why is it that we distrust? Francis Terrell down at the University of North Texas, he's got the cultural mistrust inventory. And I actually utilized that for my thesis coming out of Fisk. And it was like, it talks about how we have this ingrained mistrust for systems of authority and power. And specifically talking about psychology and mental health, as we know, many of us are aware, the APA, or American Psychological Association, just released an apology for psychology's role in racism, right? And let me share this real quick. If I could share the screen, because I'm gonna read it quickly, but I want people to see it. And then I'll also put the link to this article in the chat for anybody who wants to take their time and go through the chronology. But check this out, just real quick. So these are some of the things that the APA acknowledges psychology playing a role in. Ritch, can you see this?
Yes.
All right, cool.
Yes.
Thank you, Doc. All right, so they established and practiced in scientific models and approaches rooted in scientific racism. They created, sustained, and promulgated ideas of human hierarchy, promoted the idea that racial difference is biologically based and fixed, used psychological science and practice to support segregated and subpar education of people of color. This list goes on and on. Supported the widespread use of educational assessments, created, sustained, and promoted a view of people of color as deficient or damaged, failed to represent the approaches, practices, voices, and concerns of people of color within the field of psychology and within society. I'm not going to read all of it, but I just wanted to show that quick view, and to put some meat on those bones. So what that means is that when your child goes to get an assessment and there is a white person doing the assessment and the assessment tool is white normed and the person interpreting the tool is of a European or white superiority worldview, then what that means is that that child is less likely to come out with an accurate diagnosis and therefore accurate treatment, which then means we're going to have a large proportion of misdiagnosed children and people of color in this world. And then if you're misdiagnosed, then you're definitely going to be mistreated. And it just so happened that that same worldview loves to push the chemical approach to therapeutic intervention. So now we could call that a chemical warfare or chemical assault on the psychology of these people, our people. And they start the timeline in the late 1800s and they bring it all the way up to modern time about how psychology has systematically worked to not only label Black people, non-white people in a negative light, but to actually create and produce functional inferiors out of our people by helping with the zoning of neighborhoods, by helping with the revision of textbooks, by misdiagnosing people and giving us a disproportionate number of schizophrenic diagnoses and institutionalizing us, criminalizing certain mental health behaviors, for non-white people, but giving it a health crisis issue when it comes to the white side, the distribution of drugs in our community. So all you have to do is have a small inkling of the things that have taken place under the auspices of psychology or even the medical field. Shout out to Harriet Washington, medical apartheid. When you know these things, then you're actually functioning in a very rational way to have a mistrust of these entities and these organizations. And APA is saying it now, but y'all know Dr. Burlew, I'm sure you probably remember Dr. Williams, Robert Williams, former president of ABSI. He gave an exact list almost similar to that, wrote it to APA, back in, if I'm not mistaken, either the 70s or the early 80s, saying the same thing, the same accusations against APA, and they ignored him, right? You know, they ignored him when he tried to put it on the table. But fortunately, now we got APA, who is with Black leadership now, saying it on their own. But anybody who has a mistrust of these systems, they're not paranoid in a psychologically maladaptive way. To me, they actually have a healthy sense of paranoia, and they should be mistrusting to a degree. And that's why it's so important to all of you all that are practitioners that are of color and culturally competent, culturally aware, and cultural champions. You know, we're doing God's work when we make ourselves available to our people who do, in fact, need mental health services.
Well, the history that you just gave is why there is an ABPSI, why there is an Association of Black Psychologists, that there were Black psychologists who walked out of the American Psychological Association and said, this is not for us. But just seeing that list that Jeff just shared, you can understand why it would be healthy to have cultural mistrust, and that cultural mistrust doesn't just apply to mental health, but it also applies to our thoughts or opinions about medical, going into medical settings as well. The Association of Black Psychologists at the national level just did a needs assessment, which included a survey of over 2,000 Black folks about a number of things related to COVID. But one finding is particularly relevant here, and that is the more cultural mistrust people had, the less willing they were to take the COVID vaccine. And that makes, I'm vaccinated, so I believe in taking it, but you can understand why there might be some skepticism just because of the healthy sense of mistrust that Blacks, many Blacks, almost all Blacks have as a result of our experience in the United States.
That mistrust piece is not a joke, because what it has us doing is ignoring our needs for actual intervention, right? And we will suffer in a pathology because we would rather, in many cases, conscious or not, suffer in pathology than the risk being harmed by a potential racist in a gown, or a racist, a racist analyst, and it's very deep. So it's kind of like one of those double-edged swords that we're faced with. And that's a part of the insidious nature of racism. It'll get you coming and it'll get you going either way.
Absolutely. Absolutely. I think racism in America is a bit of a masterwork. It has not yet been defeated for what, 400 years?
More. So, yeah. Well, in America, but yeah. And so I definitely think that one of the reasons that the mission of ABPSI is to do panels like this and to make ourselves more visible is because one of the reasons I was ever even able to become a psychologist was meeting people like Dr. Burlew and my mentor, Dr. G, people who they're normal people who also happen to be Black psychologists. And so the idea that if we put ourselves out there and make ourselves visible to the community as we do things like this, it can help to sort of break down some of those barriers and ideally earn some of that trust back from the community that we know has a lot of needs that need to be met, and that there are people like Miska, like Adam, like myself and Dr. Burlew and Jeff, who are very passionate about meeting those needs for the community. We're about at the point where we're going to switch over to some questions from the audience, and I have a few in the chat, so I want to make sure that we get to these. First is suggestions on managing these repercussions of code switching. So recognizing that code switching comes with repercussions, how could we tell people how to manage these repercussions?
I actually have some thoughts there that I'll just go ahead with. That suppose you experience a microaggression. At the time you're thinking, I want to say something, but I don't know exactly what to say. And later you get home and you feel bad because you didn't say something, and you come up with a million things that you might have said. But Stanley Sue, I guess it's Daryl Sue, talked about disarming the aggressor. So if someone says something like, I know that Samela got the job, she probably got the promotion because she's Black. And we all would be offended by that. And then it's like, what am I going to say? And so Sue says that you might do something that he calls disarming the aggressor. And one way of disarming the aggressor is just a simple, there are options for how to disarm the aggressor. One way is just a simple response that lets them know you're reacting to what they said. You might just say, ouch. just let them know, they said something that you're responding to. That's one option. Another option is to encourage the person to consider the impact of what they've said or done. Saying something like, I don't know if you realize it, but that comment is hurtful. And a third approach might be that if you're in a situation where you're just, maybe you're the only Black person or whatever, you just don't want to have that discussion. He suggests that you could interrupt the comment by changing the subject. It could be something like, whoa, let's not go there. That topic is too loaded for us to get into today. But those are just 3 strategies that you might have in the back of your head so that when a microaggression occurs, you have something that you thought about that you could say.
If I may
Another
offer,
thing, oh, sorry.
So look at Miska. Go ahead, Doc.
Another thing that I like to keep in my back pocket with microaggressions is almost like asking for clarity. Like when someone tries to make a joke or something like that, it's like acting like you don't get it at all. I don't get, even saying, I don't get it, or what, or just looking and having the person putting them in a position of having to explain what it is that's supposed to be funny or what conclusion one is supposed to draw from whatever that question is. So kind of just like asking for clarity, I find is very helpful as well, because it causes some discomfort.
I like that.
Yeah, I love that. I was actually headed in a similar direction, Doc, where it's like, you ask the question. Mr. Fuller, he does a wonderful job helping you to script those appropriate responses. He got that book, the United Independent Compensatory Code System Concept. It's a textbook workbook for victims of racism, white supremacy. He's got a whole section on how to engage on this level. And so, for example, what you just talked about, Dr. Burlew, she probably only got the job because she's Black. And in sync with what Miska was saying, oh, wow, okay, that's interesting. So what about her being Black made her get the job? And what you do is you give them an opportunity, like you said, Dr. Prater, to explain themselves. And part of that is to hear how dumb they sound, right? Because, I look at these folks as idiots almost. It's just like, that's why they can't be in those contexts superior to me, because my attitude and perspective is like, yeah, not so much. And so I'm gonna give you the opportunity to explain yourself. And so you can hear for yourself how stupid it is, or so you can stumble over those words in attempts to make sense out of something that's nonsense. And that's that discomfort you talked about, Dr. Prater. But the one thing about that, if you're going to engage and if you're going to meet these folks head on, you've got to be prepared for their next move, because if you make a move, and this is a game of chess, and a lot of them are war oriented. And so if you make a move, it's a counter move coming. And sometimes those counter moves are slick and they're passive aggressive. And so, they'll take Ritch to HR talking about betting and gambling. And he had a big stack of money in his pocket. He said, bet. He tried to force me to bet him on the on the Bengals game last weekend. Why would he do that? And so you've got to be very careful if you decide to engage. Like I think you said it too, Ritch, that you've got to be prepared to do this stuff. It's not easy to have that emotional control, that stability, that sound, lucid mind to respond to these folks, because they've been at it, like Ritch said, for at least 400 years. We're trying to play catch up. We're just understanding what they're doing.
I like what Miska said and Jeff responded to, and some people in the audience today might be old enough to remember there was this TV show called Colombo, and he would get a lot of information just by acting dumb. He might say just something like, can you say more? I don't understand. And it's the same kind of thing I think that Miska was saying, that you kind of force them to explain themselves. And as they're explaining themselves, the stereotype or whatever is coming out, even for them to hear it themselves.
I'm a big fan of Colombo. It still holds up even today. It can be an enjoyable hour and a half of your life to watch an episode of Colombo. Although I couldn't tell you where to find them. They're out there somewhere if you try to stream them. Maybe Hulu. But yeah, Colombo was the GOAT. Another question from the audience is that one may not have direct power to change things in an organization, but if one has any level of influence, regardless of position in the company, do you think it would be advantageous to use that level of influence for sowing the seeds of change that may bear harvest down the line? What do our panelists think about whether or not you should use whatever little power you might have in order to change the system?
I think you got to do a risk assessment, and how likely is it that I will be able to change this organization, this corporation, this group, this small practice. And I think that if your risk assessment comes back that it's likely that you can impact change with the least amount of loss and damage to your own personal well-being, then I would say go for it. If you do the risk assessment, it's like as soon as I jump out there, I'm gonna get sniped. Then you stay behind the cover until you can figure out either a strategic exit from that overall organization, or you figure out a more strategic way of implementing the change that you're desiring to see. But you got to have a risk assessment, and every situation is going to be individual on that one.
And I think just to add on to that, I think it's really important to pay attention, for instance, during interviews, onboarding, or joining a new team. It's important to assess when and how others are expressing themselves and whether they believe that you might fit their environment. So it's important to be vigilant in terms of what is going on and what you're observing. And I think that's helpful in planting the seed. And I think one of the important things that I wanted to add to the last discussion is bringing your full self to the table. You won't know how things work until you bring yourself with you to the table. And I think what's helpful in terms of being able to do that is by getting mentorship. There's nothing wrong with mentorship at whatever age you are. We all can benefit from that, in particular when it's from people who look just like you, that have similar experiences that you can talk about your work experiences, life experiences with. So I think that those are really important pieces.
Yes, and one thing I want to add about mentorship is sometimes, particularly when we're minorities, we're the first person in this job. So you might not be able to find it at that job or in that environment. And what I often have to tell young people when I'm talking to them about mentorship is you might have to cobble together mentors. You might have a mentor like, this is a good public speaking mentor, but he doesn't understand the cultural piece. This is a good cultural mentor, but he doesn't work at this corporation, but he understands corporations. So sometimes you have to be a little bit flexible in that search for a mentor. And you might not find one person who encompasses all the things you need, but being open to looking for people. And as you said, it doesn't even have to be young people, but if you recognize, hey, there's a lot going on in my job and I need someone who can help me understand the ropes here in this circumstance, definitely being open to finding people who fit the bill, as it were.
And just to talk about your experiences as well.
Yeah.
And I think that it's healthy if you do have a variety of people that you can have as a mentor to you.
I think that's sort of the value of having support. We all need support. We all need a level of validation. And so having people, particularly as you're navigating these things, as I said, many of us found ourselves back in the office during this circumstance. And, I'll say just me personally, I'm constantly around my wife, who's a big support in my life. And now I'm back at work with these people who I don't quite know the same. It's been almost a year since I've been in this space with them. So I went from, my wife being my coworker to now I'm back with actual coworkers. Now I got to go back to her and tell her the stuff that's going on at work. Like we need those supports in our life that we can just sort of process these experiences with. And it's often helpful if they're a person who understands us from a cultural point of view. At this point, we're down to our last 10 minutes. I want to open it up to other people in the immediate audience and not just in the chat. If you do have a question from the immediate audience, you can unmute yourself and ask that question. Or you can continue to drop questions into the chat.
Yes, I have a question. I'm Donna Chambly-Ebron, and you have, spoken a lot, from the adult perspective, and and I was thinking about, I always think in terms of prevention, and I know a lot of us have young children or grandchildren who are in school systems that are primarily white school systems. And so they're facing microaggressions. I have a 13, almost 14-year-old granddaughter, is having microaggressions leveled at her at this level. And so my question is, how do we help our children, like they start very young experiencing these microaggressions from other children? And how do we help them to deal with this? And then, how can we protect their mental health? They don't have the life experience yet and experiences as Black people in this world as their, parents and grandparents do, to maneuver these situations, navigate these situations, and don't have the resources. And many times they may not have like faculty or staff that look like them either, who helps them with this. So, what can we do? It starts way before the workplace. Thank you for any insight you have on this.
That is an excellent question, Donna, and it gives us an opportunity to say that our third session, and Richie will tell us more about it at the end, but our third session is on children and working with children. So that will be our focus for the third
Great.
session.
I'll have to tune into that.
Yeah, we may put you on the panel.
No, I don't think so.
But and I think we all worry about that with our children and our grandchildren. And I think I'll start by saying inoculating them ahead of time before these experiences even happen, helping them to learn about Black culture and to appreciate not only the culture, but to appreciate themselves, giving them a healthier sense of self. But the other thing that I would add is having a relationship with your child or your grandchild, so that when it happens, they bring it home to you, so that together you can process it and you can let them know whether it was appropriate for the person to say that or not appropriate. And then you can decide whether you're going to deal with the school, so that the kid is powerless to deal with it, but you may be the one who has to go in and deal with it in the school.
Absolutely. Yeah. Thank you. Thank you. That's good.
And I'm not an educator, but it's been my experience that parents who are more active in their children's school with the teachers and or with the principals are more apt to see changes occur. It's easier to avoid the complaints of a child when the parent is not active in the relationship.
Yeah.
And so I would encourage all of those to become more active with the school, have more conversations with the teachers. You can also educate the teachers on microaggressions as well, and why this would be hurtful for children of color. So we can never overlook that piece and the power that we play as a parent or as a caregiver.
Right. We're having so much pushback in schools right now in terms of, dealing with anything related to, race and history and all of that.
Critical race theory, all that.
Yeah, I know what they're calling critical race theory, what they're calling it. So that's very unfortunate. Yes.
I'd like to just offer my perspective and suggestion on your question. One of the most important things and vital things we can do is instill a healthy sense of self-identity in our children, that positive self-esteem. Make sure that they understand about, their racial and cultural group and the greatness that it has, to claim in its historical record. And then in addition to that, also telling them the truth about those microaggressive experiences. Yeah. We know, as those that are psychologically educated and trained, that a lot of times these things are coming from a place of insecurity and a lacking of self-esteem. And so, what I love to do is I love to judo flip this stuff on racists, white supremacists. And I tell the babies, like, look, if somebody's talking bad about you, there's this thing called hating. Y'all call it hating. We call it reaction formation. Right. It's when there's something that you really desire, but you cannot obtain it. And so you make it a negative thing. And I said, and these people tend to do that. If you notice, I just cite the record form in very plain language. If you notice you have brown skin, they're ridiculing you for your brown skin. What do you see them doing in the spring and the summertime? Tanning, trying to get brown skin, right? And I said, so, you see all these different things. Don't let these people trick you into thinking that somehow you are less than or bad when you got all this evidence that they're actually trying to be you and be like you. And if you can, in whatever way, reinforce that message at the same time, instilling a healthy sense of self, self-concept, self-esteem, cultural pride, then what you're creating is, again, like Dr. Burlew said, you're putting an inoculated individual out there. They've got the jab. We got to get them their vaccine. We're vaccinated them against racism and white supremacy, the greatest virus that's ever visited this planet. It was racist 19 or something, what we gonna call it, but it's here. Even the agents on the Matrix talked about it. They said human beings, they were talking about white people, I'm sure, are a virus on this planet. Not all white people, of course, but those that are.
Right. Yeah. Very good. Thank you.
Yeah.
Thank you.
Thank you for
And
that
Rich, there's
wonderful
a question in the chat.
Yes. One statement that someone said, if you're sitting on boards where you're the only one of color, whereas the board is making decisions regarding Black and brown children, you must educate those board members and advocate for children of color. I do think, I agree that we do need to kind of maneuver into some of these positions. And sometimes it means being the only person in the room, but how can we advocate for those that look like us while in those spaces? And I think creating more spaces for us ourselves, I think is definitely of value. And then another question is, how do we suggest finding a therapist or connect with Cincinnati Association of Black Psychologists? Because there are many barriers to accessing mental health services. One of the things that I'll drop in the chat is recently there was an agency, the Collective Empowerment Group, or Collective Empowerment, I'm getting the name of it wrong, that created a directory. And I will drop the link to that in the chat. This is a PDF that is a mental health provider directory for Black and Indigenous and people of color. So I'll make that available to you now, as well as the website for Cincinnati AB Psy. It is right now just a landing page, but we will in the future be providing some resources as far as our own directory of members as well as providers from AB Psy. So I've dropped those two things in the chat as a way to connect with the Cincinnati Association of Black Psychologists, as well as a directory of some Black psychologists in the area. And could some of our other panelists like Adam and Miska, who are in private practice, talk about some ways to connect with therapists?
Yeah, the other thing that I was saying, I always encourage clients, depending on what the issues are, the specificity of the issue, is to utilize their health insurance panel and using the filters to be able to look at what are the specifics that they're looking at, whether it's LGBTQIA+ therapist or etc., or if they're looking for specific testing. But there are ways to filter down those choices, which is helpful, and it does save a lot of time. So that's one of the things that I would suggest that you do.
Yes, I would also suggest too, as you're calling around to places, I know when people have called our office before, they've been a little kind of around the bush about it. It is totally okay to call places and be like, y'all got Black therapists, because that's what I want. And letting people know right off the bat, this is, maybe the age range that I want, the gender that I want, the ethnicity that I want, not being shy about that, and also not feeling like you have to settle about that, because we do exist. So
and let me add
what you desire.
And let me add just a little bit more to that. You can also do what's a consult over the phone or however you're meeting with the individual, and you can ask questions about how they may approach particular issues that your child or yourself that you might be having. And you can also ask about what their theoretical position is. So there's lots of things that you can do. Just because you call and you make an appointment does not mean that you are kind of linked to that person forever. So remember that you do have power of choice and you can change your mind at any time.
Absolutely.
Sorry, I'm admitting as well as I'm dropping links in the chat, which distracts me. So we are coming around on the end And this has been a wonderful discussion, and I'm so glad to have been able to spend my actual birthday with you people today to have this conversation about racism and discrimination and microaggression. So thank you all for those who attended, those who asked us wonderful questions. Thank you. Shout out to my wonderful panel of illustrious professionals, Adam Evans, Miska Prater, Kathy Burlew, and Jeff. Thank you all for being here.